Lung cancer is the leading cause of all cancer deaths in men and women, making up about 1 in every 4 cancer deaths. It's most treatable when caught early, but since the start of the pandemic, many people have delayed their preventive cancer screenings, which is having a negative impact nationwide. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week we're talking about who should start preventive cancer screenings and latest advances in treatment as we kick off Lung Cancer Awareness Month. With me today is Dr. Janakiraman Subramanian, oncologist and director of St. Luke's Center for Precision Oncology. Thank you so much for joining us.
Thank you, Lindsay.
So, Dr. Subramanian, as mentioned, there's been a pretty big decline in preventive cancer screenings over the pandemic. What impact have you seen on lung cancers because of this?
Right. The number of patients that we are screening for lung cancer has definitely gone down, and it's been a significant decline. And there are some early trends that suggest that patients are being diagnosed more often with advanced stage disease than early stage disease. Of course, further data is needed to confirm that. But if that is the case, then our chances for a patient with lung cancer to be cured gets to be decreases because early stage disease we can cure, whereas advanced stage disease, we can treat, but we cannot cure that cancer.
Now, on that note, why is it so important not to wait until you have symptoms to come in for a screening?
Right. By the time these patients have symptoms, it is an advanced stage disease. That is why we don't recommend waiting till symptoms. In fact, the whole idea of prevention is to identify the cancer before the development of symptoms, such that they can have, they're more likely to have an early stage lung cancer, which we can treat with curative intent.
Okay. So we know, of course, that a history of smoking is the top cause of lung cancers, about 80 to 90%. Non-smokers can get lung cancer too. What are some other risk factors?
Right. Environmental tobacco smoke, what we call as secondhand smoking, is a major risk factor. So is other factors such as radon or other chemical carcinogens. In some cases, there is even data on certain viral infections playing a role.
Okay. Now, early detection through low-dose CT lung cancer screening is proven to reduce lung cancer deaths by about 14 to 20% in those who are at higher risk. Can you tell me about that screening and who qualifies?
Right. So, lung cancer screening, we do it with the low-dose lung CT. It's done once a year. And the patients who qualify for that are the ones who had a 30-pack year smoking history, either current or former smokers, and age group of between 55 to 77 years of age. And for former smokers, their quit date should be within the last 15 years to qualify.
And I understand a U.S. task force is now having new recommendations for that.
Right. So the USPSTF came out with new recommendations approximately a year ago, where they have expanded the age range for patients who are eligible for screening, and has also dropped the pack year requirement to 20 pack years instead of the current 30 pack year requirement. So if someone is concerned whether they would qualify for screening for lung cancer, it would be best to discuss that with their care provider and see if they would be a candidate for screening. Okay,
good to know. Now, although it remains the deadliest cancer, there is some good news. More people are surviving lung cancer now compared to 10 years ago. What can you tell me about some of the latest advances in treatment and research that are improving those survival rates?
Absolutely. Personally, as an oncologist, it's been very heartening to see the progress that we have made, and this is reflected in how well our patients do. Despite the progress, there is still a lot to do, but the key areas where we have improved are in how we stage our patients. Now, stage is what tells us how big the lung tumor is or how widespread that tumor is, and based on that, we develop our treatment plans. And usually to accurately stage a patient and then deliver the right treatment, you need a strong multidisciplinary group of experts. And that includes thoracic surgeons, radiation oncologists, radiologists, interventional pulmonologists. And thankfully here at St. Luke's, we have the thoracic clinic program which brings us all together under one roof and one location, and we are able to accurately stage our patients and deliver the appropriate care. The other significant advance is in identifying what are the molecular drivers of lung cancer. We do this by next-generation sequencing, and this helps us to tailor our treatments such that they are specific to each patient's cancer. And the Precision Oncology program at St. Luke's has been a leader in that field, and not only in the clinical care of patients with lung cancer, but also in research. And so that has been another significant advance in how we take care of our cancer patients.
Great. So lastly, moving forward, what excites you for the future of lung cancer treatment?
The research that's currently happening in lung cancer, or for that matter, any cancer, is quite exciting because there are so many areas that it's expanding, and that provides us with new opportunities to take better care of our patients. Some of the areas which I touched on earlier is understanding the molecular drivers of cancer. Not only it allows us to find specific treatment options for patients, it also allows us to identify the type of lung cancer, because we know that lung cancer is not anymore a single disease. It's a collection of diseases, and identifying the subtypes or the molecular subtypes of these cancers also allows us to better understand the disease, how to develop an appropriate plan for those patients. The other area of significant interest is leveraging our own immune system to target the cancer. We now already have agents that we use in the clinic to treat patients by activating their immune system against cancer. But the research has expanded significantly that more newer agents are being tested, and we think that they'll be available for us in the clinic in the next several years. So those are very exciting changes in lung cancer treatment.
Wonderful. Very exciting. Well, thank you so much for joining us.
Thank you.
If you'd like to learn more about the different types of lung cancer screenings offered at St. Luke's, visit stlukeskc.org/lung cancer screening. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.